What is pelvic stenosis, and can it impact pelvic floor dysfunction or lead to pelvic floor dysfunction is the question you asked. So technically, pelvic stenosis is not a medical term. You can have narrow pelvis, but stenosis in general means narrowing, and you can have spinal stenosis. That could be where the nerves exit the spinal cord, or the spinal column being narrow, impacting the spinal cord, and of course there are associated symptoms to that. So when you talk about pelvic stenosis, it's more of a narrowing of the pelvis, and of course there are two scenarios to that. One is anatomical, in which case, you know, your pelvis is just narrow. So that means if it's narrow, that means the stuff that needs to go on the inside, which are your pelvic organs, which are your bladder, uterus slash prostate, or uterus and ovaries and slash prostate, and then of course your intestine. Then you've got your nerves going there. You can have blood vessels there, and of course there are joints and muscles. So if this pelvic inlet, the whole pelvis is narrow, those structures can be pressed on, and you can have symptoms associated with it. Then you have situations where people work out, and so they have whatever width of the pelvis is, but they really heavily build the top. So the top of the trunk is not matching its base. Now you're basically, the ratio is off, and now you have created an issue there. So the base is not wide enough for the structure that you created above. That typically it's created by the person, by the type of workouts that they do, and so that's more of a created pelvic floor dysfunction. Granted, it wasn't voluntary, but that's what it ends up being. So to answer your question, can it be related? Yes. And it can show up as whatever symptoms of pelvic floor dysfunctions are. I've done videos on what are some of the symptoms of pelvic floor dysfunction. We'll make sure that we put it at the end of this video so you can see what that, some of them are not as obvious to people, because most often people associate pelvic floor dysfunction to urinary dysfunction, perhaps bowel movement issues, or sexual dysfunction, and there's far more symptoms and signs that are associated with pelvic floor dysfunction. So we'll make sure that we put it at the end of this video. If you haven't subscribed to the channel, you probably should. Listen, I do videos on a weekly basis. I think for this channel I do, what is it? Twice a week. That's a lot of videos I put out there. I'm not holding any information back, but I'm here if you need help. Use one of the methods of contact in the description box to contact me. I'll be more than happy to take a look and see. Doesn't matter if you're local or not. We can still chat and see what's going on. Contact me, subscribe to the channel, and I hope this helped you. If you have any questions or comments, put down wherever it is that you can comment, and then we can see what happens. I can maybe do more videos or answer your questions. Until next time, take care.